Hey guys, this is Dr. D here, ER doctor turned psychedelic medicine enthusiast. And I want to be really candid and vulnerable with you today and share with you my journey of mental health and struggles. See, as an ER doctor for over 20 years, I took care of thousands of people struggling with their mental health. I'd see people come in at their lowest, feeling suicidal. Maybe they've overdosed on drugs. Sometimes people were just kind of at their wits' end. They didn't know what to do. And to be quite honest, in the emergency department, our ability to help those people was fairly limited. I mean, as far as basically figuring out, like, does this person need to go inpatient because they are suicidal, they're at risk of completing that and ending their life, or is it someone who's safe to go home, follow up as an outpatient? And some people, it was just a revolving door and was pretty limited in how I could help them. But along the way, during those 20 years, I also was personally struggling. I never had to go to the ER for my symptoms, but probably could have at times. You see, I developed depression in my late 20s, early 30s especially. And I was on multiple different antidepressants when I finally did go see a psychiatrist. We tried one antidepressant for 3, 4, 6 weeks and it wouldn't work. And so we'd switch to a different one for another 3 or 4, 6 weeks, maybe kind of helped. We'd add another drug. And I was a patient just like some of you have been. And there were times that my life got really dark and there wasn't even necessarily always a reason. And I'll get to that in a minute because I think we can unpack that a little bit. At times there were situational issues. But times I just felt overwhelmed and helpless and hopeless. You know, I'd wake up and just feel blah for no good reason. I had a great job and was earning good money, and maybe there were some issues with relationships that I had, but not a reason to feel that dull. And I just feel like nothing's ever going to change. You know, and I think that's where that hopeless feeling comes in. And to be quite honest, there were multiple times that I considered self-harm, that I considered taking my own life. Thank God I didn't do that. But now I'm better. And I'm better because of psychedelic therapy. The only legal psychedelic in Indiana is ketamine. And that's the therapy that I reached out and I got that help back in 2020 when I was really struggling with burnout and just feeling overwhelmed and feeling days like I just didn't think it was worth going on, honestly. And so, you know, I share a lot of content about this because it's radically changed my life. Literally, what I would say is it has put my depression into remission. And that's an interesting term because normally we use remission to think about mostly cancer and maybe some other medical diagnosis, but mostly cancer. Well, I know a psychiatrist and she calls depression cancer of the soul. And I can see that analogy because depression starts out and then its impact kind of has these tentacles that affect every other part of your life. It affects your relationships. It affects your self-worth. It affects how you parent your children. It affects your relationship with your coworkers and how you perform your job. And so I think that term remission is very valid for this. And so in 2020, I went to a clinic about 90 minutes away and had ketamine therapy and didn't really know what to expect, but went in there with, you know, a positive attitude that hopefully this will be helpful. I had given ketamine for 20 years in the emergency department to sedate mostly children for painful procedures. So it was a medicine that I was familiar with, but I'd never received that. I'd never had any sort of psychedelic treatment whatsoever. Hadn't even dabbled in that stuff recreationally. And what's interesting is the effects from ketamine, the changes are subtle. You know, it's not like I have anxiety, I take a Xanax, and 20 minutes later, my anxiety's gone. But then 4 hours later, it's back, right? So the effects are more subtle than that. But what I really noticed was things that were previously bothering me, like my shifts in the emergency department. I still didn't enjoy them. I still didn't love them, but they didn't grate my soul like they had previously. And I'll tell you, doing this therapy at our office, that's the feedback that I get from patients all the time, is they just feel more empowered to get through the hard. They feel like they have more resiliency in the suck. Life is still hard. Life's still difficult. It's still going to throw us those stressors and those curveballs. But one patient in her early 20s told me the other day, she goes, I just feel like that I have more space to decide how to react. And rather than just having that gut reaction where you just do the first thing that comes to your mind, there's that ability to pause. And I want you to understand, why did this therapy work so well? Because we see a median 75% reduction in depression and anxiety scores over a 3 or 4 week period of time. But why does that happen? Well, I'll tell you why. Because this therapy, unlike the prescriptions that are given out for depression and anxiety, this therapy is targeted at getting that root cause. It's so effective because of how it heals the brain, how it restores these neuroconnections. You see, we have to understand, why do we develop depression and anxiety? Why was I struggling with that for the past 20 years? It's because my brain wasn't healthy. I was always trying to find the thing that was going on in my life. Well, if I, get a different job, or if I pursue more hobbies, or if I just read more self-help books, then I'll figure it all out and it'll be fine. But none of those panned out. It was the same issues, just in a different environment. So why do we get depression and anxiety? Well, I think it really comes down to chronic stress causes loss of neuroconnections in the brain. You see, high stress levels cause one end of the nerve, called a dendrite. Dendrites are these finger-like projections. And so dendrites connect nerves to each other. So chronic stress, high cortisol levels, cause a loss of neuroconnections in the brain, meaning that now the nerve signals aren't flowing as well. Or you could think of it like this. Sometimes just having the same self-defeating thoughts over and over and over and over again, it hardwires our brain to think those thoughts. There's things that you just accept for granted, that that's just how life is, or that's your view. But that might be because your brain's not healthy because you've thought the same thing, or you were told the same thing over and over again as a child. Maybe you're told that you weren't good enough. You didn't live up to the expectations of the people around you. And so now you just carry that through life. We had a patient in recently, and everything that happened, like, she just apologized. I'm sorry. And, I think that's a reflection of her self-worth. And maybe she heard that growing up all the time, that what she was doing wasn't adequate for the expectations, so she needed to apologize. But we can get these ruts in our brain, right? And it's like, literally, if you think of a rut like Jeep tires, and the Jeep can't get out of the rut. And so what medicines like ketamine do, and even other psychedelics, is they come along like a bulldozer and they grade over the ruts. They fill it in, right? So now there aren't any ruts. So now we can lay down new patterns of thinking. And that's why I think counseling coupled with ketamine therapy can be so impactful, because now not only are we limiting the brain's ability to stay stuck in that rut, but we're also able to lay down new paths, new ways of thinking, new ways of framing either what we've been through in the past, or maybe what somebody did to us, or what we did to someone else that still hurts us. Maybe we can reframe that, or what we're experiencing right now, we can see it in a different light. And I believe that ketamine therapy can allow counseling to be more impactful. I've had patients literally tell me that. It changes how they go into their counseling appointments, and they get more out of it. And so for me, this has really been life-changing, because now I don't take any medicine for depression. I never really struggled with anxiety a lot, but I don't take anything for depression or anxiety. And I don't struggle with depression now. And so I just want you to understand that if you've tried all the meds, you've tried all the therapy, there is still hope. There are treatments out there that are effective beyond taking a pharmaceutical every day. And those are often coupled with like side effects that no one wants. The two big ones, weight gain, loss of libido, right? Nobody wants those. But the other thing that I find is that a lot of times for a lot of people, not everyone, but for a lot of people, the antidepressants, they don't get people to where they want to be, right? Maybe they're better. They're not as low as what they could be, not as low as what they had been, but a lot of times they're just not thriving. They're not waking up with joy and purpose, ready to go out and slay it in the world. And I think that when the brain is healthy, that's what my patients tell me that they start enjoying. They get back to doing things that they used to enjoy. One guy told me when he first came in, he's like, yeah, I'm not riding my mountain bike anymore. And like before his second infusion, I'm like, how are you doing? He's like, well, I'm back on my mountain bike. So people start getting motivation. They start thinking more clearly. They start having more space, and they start having more resiliency in the suck. So if you're out there and you're struggling with depression or anxiety, you just feel like that it's not as good as what it could be, find a provider near you that offers ketamine therapy, and get an appointment, get a consultation, whether that's with us or somebody else, whatever. But get this therapy because it can literally change your life in a matter of just a couple of weeks. And so I hope this helps. Thanks for letting me share my story. God bless you guys. I hope that you have a healthy, awesome 2025.